So, the first topic I want to talk about today is a pro freedom approach to fighting COVID 19. There's a really pervasive assumption that I'm noticing in the conversation. And, one way you can see it is that most of the people supporting lockdowns in response to the coronavirus slash COVID-19. COVID-19 refers to the disease that manifests, but I'll just use that in general. When people are talking about, I have serious concerns, that usually means, oh, I support the lockdowns and those should continue indefinitely. And then many times people, when saying I advocate freedom, a lot of it is based on, well, I don't think COVID-19 is that serious, or at least I think it's less serious than some of the dire predictions that we hear. Now, I definitely think it's less serious than some of the most dire predictions we hear, because I think there's systematic distortion that tends to exaggerate how big negatives are, and also to underestimate the capacity of free people to deal with it. But nevertheless, I do think of this as a serious thing, and I don't think it's proven, but I will not at all be surprised if it ends up being much worse than the flu. It's obviously worse than the flu in terms of the concentration of it. So it's spreading quickly enough so that certain healthcare systems, although by no means all, are overloaded. But I want to say for today, let's assume it's 5 or 10 times more severe than the flu, and that would be a really, really big deal. What I'm going to say today is that still does not mean that lockdowns are good. And I'm going to refer to lockdowns as general imprisonment, because I think that's what they really are. They're imprisoning us in our homes. And I think that no matter what the severity, freedom is the right policy, but we need to have a proper understanding of freedom. And I think one thing that's totally missing from the discussion today is a proper understanding of freedom, and how a policy of freedom, deals with infectious diseases. Not just free people having ingenuity to fight them and to use their own judgment in avoiding or minimizing them. That's a big part of it. But also how a policy of freedom includes defining rights to prohibit certain types of activities in terms of spreading infectious diseases. So let's jump back and just talk about, what does a policy of freedom mean? Because often people equate freedom with, well, everyone is free to do whatever they want to do. And that is not what freedom means. When we talk about a free society, when we talk about America being free, we don't mean, oh, everyone can do anything they want to do. It means that everyone is free, but they're free to act within clearly defined rights. And rights, and particularly individual rights, is a crucial concept for understanding what freedom is. So rights are moral principles that they're defining our freedom of action with respect to other people, including its limits, the limits of that freedom of action, so that everyone has the freedom of action they need to survive and flourish. One of the assumptions behind rights, and this is a big issue, and I have a guest, which I'll talk about in a minute, to talk about this more next week, but one of the key ideas around rights is that for human beings to survive and flourish, we need to create value. Value isn't just given to us. We need to actually create it, including just creating the material sustenance and the material protection, the protections from nature, and including different kinds of diseases that we need to survive. That's not automatic. And so we need those values. We need to create them. And to create them, we need to be free to think and then to act on our thinking. And that, I believe, is really the basis of rights. And so freedom of action is fundamental to human flourishing. And so what rights are saying is, we're defining principles so that you can take the actions, including engage in the thinking, that you need to create value and flourish. But we're defining it in such a way so that everyone can do this. So an example is, if we think about what a free countries include, it's not an accident they include specific prohibitions on things that are determined to be violations of rights. So for example, murder, theft, fraud, you wouldn't say, oh, well, it's not a free country because you can't murder anyone. No, murder is a violation of freedom. It's a violation of the rights that are defined to protect freedom and to protect everyone's freedom. And then, killing somebody innocent directly is the most direct violation of their rights, because you can't be free if you don't exist. So it's a really important point that being a free country includes specific prohibitions on things that violate rights. That is, they interfere with other people's rightful freedoms. And so this very idea applies to infectious diseases. A free country should definitely have specific prohibitions with regard to infectious diseases. So there are certain things with regard to infectious diseases that violate rights, and governments should prohibit them in the name of properly protecting people's freedom by properly defining rights. So, for example, in a free country, you don't have the quote freedom to create an infectious disease in a lab and then vaporize it in a public place. If a foreign country does that, that's biological warfare. But domestically, you're not allowed to do that because it's a violation of everybody's rights. It's a very direct interference with their lives and with their freedom. And so now the tricky question is, with regard to COVID-19, what specific actions constitute a violation of rights and should therefore be prohibited? And this is not an easy question. And the point I want to emphasize today is that being for freedom includes being for laws that prohibit certain things that are determined to be violations of rights. And it's a complex question. There are a lot of things involved. One thing that definitely needs to be involved is evidence of harm, and really, I think, of unusual harm. So if we're talking about, governments restricting certain kinds of behaviors, they really have to have evidence that those behaviors are causing, other people to get this virus. It can't be, speculation, or it can't be models with very questionable assumptions, and then you start taking away everyone's freedom. But so one aspect is evidence, but there are a lot of different aspects. And fortunately, I have a really smart guy coming on to discuss in depth for a whole episode what a pro-freedom approach to COVID-19 looks like. And the guest, he was actually, I think, the third guest on Power Hour. He was on 9 years ago. Onkar Ghate, who's been a mentor of mine over the years, is the head intellectual at the Ayn Rand Institute, where I used to work. And he and I have been talking about this issue some, and he's agreed to come on and talk about what a pro-freedom policy looks like. So we'll talk about that. But for what I want to focus on today, which I think even if people just got this, it would be huge progress, is to focus on why having policies that make specific prohibitions, so prohibiting things that violate rights or that are determined to violate rights, why specific prohibitions are so much better than general imprisonment. So there's this narrative that, if you're concerned about this disease, then you need to imprison everybody. And I just want to make the point, no, that is not even remotely true. It's actually an incredibly irrational policy to imprison everybody. So here's just some examples of what I'm calling specific prohibitions to protect rights, what those might look like. And these are just hypothetical because there's a whole question of what these should be. But I just want to show today how having specific prohibitions is much better and more fair and leads to much better outcomes and more human flourishing than general imprisonment does. And I want to encourage everyone who is in any kind of position of influence, don't have this false alternative of either general imprisonment or government does nothing. It's much better to have specific prohibitions that are ultimately determined to violate people's rights. So one kind of thing is, no coughing or sneezing within 6 feet of another person. That could be one. Or no going within 6 feet of another person at all during a particular stage of an outbreak. So one thing is you can prohibit things at different times depending on the context. So you can say at one time something violates a right and another time it doesn't, just depending on the objective danger involved in the situation. Another one could be no going to a public place if you've experienced any COVID-19 symptoms. And then a final one, and this is more extreme, but no going near someone in an elevated risk category if you haven't been tested. So elevated risk category could be people who are elderly to a certain degree, people who are obese, people who have diabetes. And this would be an example of a prohibition that involves what I've called selective isolation. So instead of saying, well, everybody has to follow all the same rules, everybody has to be isolated, you could say, well, no, this is a restriction or a prohibition that prevents certain vulnerable people from coming in contact with others, but it wouldn't forbid, for example, two 20-year-olds from coming in contact with one another. So part of how I think selective isolation should happen is there should be as specific policies that recognize that certain groups of people are under greater risk themselves, and then also, insofar as you're focused on the hospital system, are at greater risk of overwhelming the hospital system. So there are many advantages, but I want to focus on three in terms of general imprisonment versus specific prohibitions. So number one is that general imprisonment deprives us of most of the freedom we need to flourish, whereas specific prohibitions leave us overall free to live our lives and flourish, and just are prohibiting specific behaviors often that we can work around effectively. So for example, an example that's very close to my heart here in Orange County, California, and really in California more broadly, is at least in Orange County, like, we're forbidden from going to any parks. So there are all these amazing wilderness areas, parks that we can hike around, walk our dogs around, get fresh air. And if you had a policy that said, okay, what's really dangerous at this particular time, at least, is being within 6 feet of strangers, and so, or maybe of anyone. And so what we're going to say, okay, you can go to these places, of course, but you have to be 6 feet apart. And, in general, we've seen people have been generally following this. Sometimes they don't, and then you can decide what to do about that. But okay, if you have that, then most of the people can enjoy the parks. Maybe they'll go at different times. Maybe at any given time it can accommodate fewer people. We can mostly work around that. Versus stay at home just means no, you cannot go to this park. So if your health is and well-being are really related to being able to go outside, which I definitely consider mine, then the government's just saying, oh no, you can't go outside because we've decided to imprison you. That's our solution. Whereas the rights-based approach says, no, here's the specific thing that we believe threatens the rights of others, and so we're prohibiting that. So it's much, much more rational. Or take doctors' offices. You have all these doctors' offices shut down, and it's, okay, let's say there are 6 feet of spacing, so maybe the doctor's offices can't take as many patients at a time, but they can still take patients, and people would be going in for what are called elective procedures, but those are often really vital to their health. I have examples myself of things that I have some concern about, and so part of it is I can talk to the person over the phone, but I might want to be examined, and they're just saying, oh no, indefinitely, no elective procedures, because you have to stay at home, because we've decided that imprisonment is the way to deal with this. Advantage number two is that general imprisonment forces us to unnecessarily increase the danger we face from the virus, whereas specific prohibitions do not. So this is a really important point, because there's assumption that, if we imprison everyone in our homes, then that's a super, at least, yeah, it might screw people over in a lot of other areas, but at least it's a very reasonable policy to minimize the danger from the virus. But this is not at all true. Is it possibly true that just forcing people to stay together inside with the people that they happen to be usually related to, that's the optimal thing to do with a contagious virus that disproportionately affects certain populations, including older populations? So, for example, and then there's the whole outdoor element. So general imprisonment basically prevents us from going outside, or it really limits that. Yet going outside is crucial for health in general, and it's almost certainly crucial, assuming you have proper spacing, for lowering a COVID-19 risk. Because you just think about, in general, viruses do worse in the summer and in the spring, in part because people are outside, and sunlight and and warmth in general seem to be hostile to this virus and to a lot of viruses. So that seems to be a lot of why, again, viruses tend to go. There's a cold and flu season, which tends to be have people be more indoors. So they're basically saying, hey, yeah, you need to be imprisoned, which on top of ruining your life in a whole bunch of ways, you're actually going to be more susceptible to the virus in this respect. And then another one is that general imprisonment forces young, low-risk people to contaminate their parents. So you think about what happened with sending all the college kids home. And surely some kids on campus would have been much better off on campus getting immunity themselves and staying away from their parents who, particularly in America, where there are a lot of bad, they're like, I think the average health in many ways is lower than other places because of diet and lifestyle. Like they're putting their parents at risk. And again, this is part of the general imprisonment. I mean, it's in effect family imprisonment. Like the government's decided, yeah, this seems convenient. Let's imprison everyone in their own homes. And this is going to be optimal, but it's not. So if you had specific prohibitions against specific behaviors, but otherwise people were free, then young low-risk people could live together to develop immunity, and they could protect their parents. So notice with, before we had the general, one is that, with specific prohibitions, we have as much freedom as we can get, as much freedom as is legitimate in a given context. So we get to do all those smart things in general with our life. And then in terms of, and we also can avoid doing these stupid things that the government is forcing on us. So those are the first two advantages. And then the third advantage, and there are more than three, but I'll focus on some more next week when I talk to Ankar Gate. But number three is that specific prohibitions recognize that so this is a broader point, our primary means of dealing with this virus is the freedom to act according to our best judgment. It's crazy to me how freedom is viewed as a liability in general. It's like, oh, if only we were like China, then we could get rid of this thing. And it's like, no, that's our means of flourishing in general. That's what the government is supposed to protect. And that also is what unleashes all the ingenuity that allows us to protect ourselves effectively. It's like people in the Middle Ages didn't have any freedom, and they could lock anyone up they wanted to, but it didn't do them much good because they didn't have all of the developed knowledge and technology that free people later created. So one aspect is free people. The more freedom we have, the more producers can produce effective, different kinds of ways of helping us with the virus. So different tests, and we see, why is our testing so bad? In large part because the government irrationally restricted testing. It said, well, in effect, testing for private people to test violates rights. And I think that's wrong. It's a violation of our rights to prevent us from developing tests and using tests according to our best judgment. Or, you think of immunity reduction methods. So different, people can come up with, hey, are there different ways of immunity reduction? Sorry, that's actually the wrong, that's an improper slide. It should be vulnerability reduction methods or immunity increasing methods, or you could think of it as dosage reduction methods. So I talked about this last week where, for example, it could be, well, people can come up with methods of maybe even something like irrigating your sinuses can help in terms of the viral load, or maybe certain kinds of vitamin combinations can help, and different people can experiment in different ways. And then there are treatments, and of course there's the different kinds of controversial treatments that the president talked about, and then they're getting criticism. But the more people are free, the more they can develop these things, and the more they can experiment with these things. And then, of course, protective gear, which is another thing where there are all kinds of restrictions on. So we need freedom to fight this virus, which means producers need to be free to produce. And then we also need freedom as patients to exercise our best judgment, both about what will help us with the virus, but as part of helping us with our overall lives. So, for example, we need to, the more we think about freedom, the more we recognize, hey, we have the freedom. We need the freedom to make the right decisions for ourselves, and we also have the responsibility to do this. The virus doesn't just impose itself on us and we're completely helpless. There's a ton that we can do to avoid it and to minimize it. So one thing I talked about last week is engaging in viral load reduction. I'm very interested in anything that decreases the dosage. And one example I brought up was Robin Hanson, the economist, has been advocating what's called variolation. So taking low doses, actually exposing yourself to low doses of the virus, like people used to do pre-vaccines, and we don't have a vaccine for this coronavirus right now, and who knows when we'll have one. So that's the kind of thing we need to be free to take those kinds of risks. But that's something that's incredibly discouraged by governments. I don't know the exact state of law, but the point is we need to be free to do stuff like that and we have the responsibility to do it. Anything we can do to increase our health and immunity. And I was listening to one of my favorite commentators on this issue, David Katz of Yale, and he was talking about how even just on a day-to-day basis, changing your diet can help. Like it can help you a little bit. There are certain things you can do to even improve the way your body's functioning, even starting now. And of course, longer term things will help more. So we need the freedom to do this, and then we have the responsibility to do this. And the more the government's focused on freedom, the more it's recognizing, hey, you as a patient are not just this helpless thing. You have the right and the responsibility to take the actions that you judge best. And that includes the responsibility to exercise the best judgment you can. Another thing is trying different kinds of experimental drugs. It's one thing to say, okay, this isn't proven, so not everyone should use it, or this isn't proven to a certain standard or universally, but any kind of these things where states are starting to prohibit specific drugs universally, that is hugely problematic. And we've seen with the FDA just has so many prohibitions, whether it's for the producers or whether it's for the patients, and this is interfering with people acting on their best judgment. And that's what we need to be able to do in life. And that's what we need to be able to do with this virus in particular. So the bottom line is whatever the severity of COVID-19, we need to be free to act according to our own judgment. And that's true as individuals, it's true as producers, and it's true as patients. And so then policy-wise, this means we need to shift from the wholesale violation of rights and the destruction of freedom, which is occurring through general imprisonment. And we need to shift from that to the consistent protection of rights through specific prohibitions. So now when you're seeing these different kinds of plans that are being floated and these different discussions, think about no matter what the severity is, these lockdowns, this general imprisonment is an incredibly irrational policy. It doesn't optimally protect us from this virus, and it certainly doesn't protect the freedom that we need to live and flourish. So, and it's possible to have policies where we are free and where our rights are defined in such a way that we really are protecting other people from really irrational and damaging things, but overall, we're leaving them free to live their lives. And so that's the ideal, and that's definitely possible. More on that, on the details of that next week. But if you take nothing else, just general imprisonment is an irrational, immoral, unjust policy. And insofar as the government has evidence about different things being dangerous, it should have specific prohibitions that it can demonstrate are really violating people's rights, and then make those law. So that's the policy there. And part of that is, just one final note, is all of this needs to be backed up with objective evidence, not just authority, not Gavin Newsom says, oh, I think 56 million people will have this in 8 weeks, or whatever exactly said. And not ignorance, not, oh, we don't really know what's going on, so we're just going to imprison you just to be safe. Or pseudoscience in terms of, oh, well, I just saw a model and the model said 2 million people are going to die or 5. And so that is a law. Like, no, you need much more significant evidence. And one point that I've heard Onkar Ghate talk about, and that I definitely agree with, is that the less certainty the government has, the less right it has to restrict our behavior. It can give guidelines and it can say, hey, here's here's what we know, here's what we don't know, here's what we advise. But it can't say, hey, we really have no idea how significant this is. We don't really know, for example, what the death rate is, but we're going to completely upend your lives. And that's part of the reason why you want specific prohibitions, because you wanted to say, okay, maybe we know enough to say, okay, don't go within 6 feet of people in this context. You want to do the things that are as low cost to people as possible. Whereas the general imprisonment is saying, let's think of the worst thing that we can do that we know in specific ways will harm people in terms of protecting themselves from the virus and will ruin many, tens of millions of people's lives and cause all sorts of mental health problems and physical health problems. And we're not certain about the evidence. That's exactly backward. Another perspective on a pro-freedom government is the government is our agent. It's our bodyguard. So it's supposed to be helping us and protecting us in terms of giving us the freedom to achieve our different goals, including protecting us from other people when they're genuinely out of line. But it's got to be really careful about what does it really mean to be out of line. So it needs objective evidence, not authority, ignorance, or pseudoscience. One more note, you can probably tell I'm worked up about this, is that this idea of a pro-freedom government that is defining individual rights, this, and we'll talk about this next week, this is really the key to resolving the false alternative of, do we save lives or do we, quote, protect the economy? Now, part of that is protecting the economy is saving lives. So that's one aspect of it. But the real thing is that the government should not be picking winners and losers among individuals. It should not be sacrificing some individuals to others and saying, oh, your life matters and your life doesn't. The government is supposed to define rights in a fair way that gives all of us the freedom that we need. And then we have the right to make different kinds of decisions and take on different kinds of risks. And you could think of an example like cancer. We wouldn't say can the government imprison us to say, well, we want to save lives from cancer. We're going to minimize cancer risk. And so, yeah, you all get imprisoned. Now, of course, that's going to hurt, quote, the economy. But the real thing is, no, this is immorally depriving people of freedom. And if the government thinks it has good ideas about avoiding cancer, it can say it. And the government can prohibit things like you're not allowed to expose your neighbor to X amount of radiation because that could cause cancer, or you're not allowed to fraudulently cover up information that something causes cancer. So it needs to define rights, but otherwise it leaves us free to deal with cancer risk on our own. Its goal is not to save our lives or to save some people's lives. It's to protect everybody's freedom. So ultimately, this freedom and rights-based policy gives everyone the freedom and the responsibility to live their own lives as they judge best. And it does not allow the government to say, oh, I think this 80-year-old's 3 months in the ICU is more important than your restaurant. That is not an American philosophy. And there's no way of some third party weighing it and saying, hey, which matters more, this or this? In a free society, ultimately that's up to the choices of individuals, including, and this is a bigger subject that we'll talk about next week, including how much what do individuals choose in terms of how much they want to pay for healthcare, how they want to take care of their health. They need to make these kinds of decisions, but they should not be free to force others to pay for their mistakes. Okay, that is a pro-freedom approach to COVID-19, and specifically why general imprisonment is always the wrong policy, and why no matter what the severity is, we want to be looking at what specific prohibitions are violating rights, and therefore what specific prohibitions can we pass to protect people's rights.
Power Hour. Life, liberty, and the pursuit of energy. Power Hour. The antidote to shallow thinking about energy issues.